My job as Prime Minister is to do what I believe is right for the long term of our country. And if you talk to any parent or teacher, as I've been doing here at this school in Darlington this morning, they'll talk to you about the worrying rise in vaping amongst children. Now, children shouldn't be vaping. We don't want them to get addicted. We still don't understand the full long-term health impacts of vaping. So it's right that we take strong action to stamp this out. That's what we're doing. Banning disposable vapes, taking powers to go after the flavours, the appearance, the packaging where vapes are displayed in stores, but also improving enforcement, making it easier to levy on-the-spot fines at retailers who shouldn't be selling to kids. Taken together, it's a strong set of measures so we can improve our children's health. It's the right long-term thing for the country. It's important that we maintain vapes for adult smokers who want to stop, because for those people, it's obviously preferable that they vape rather than smoke. That's why actually we're pioneering the Swap to Stop campaign. 1 million people are being provided with kits to help them through the NHS, and actually we're one of the first countries in the world to do a program like that. It's also why we have balanced these proposals, targeting the things that are particularly appealing to children. And that's what this is about, is protecting children's health. That's why the marketing, the flavours, the appearance, where they are displayed in stores. And what's clear is it's disposable vapes that are behind the very worrying rise in children's vaping. Children disproportionately and overwhelmingly use disposable vapes. So I think we've got the balance right. Supporting adult smokers to stop smoking with our vape kits and dedicated support for them, but targeting all the things that make sure that children shouldn't have access to vapes. But on smoking, there's been a long tradition in Parliament of these being free votes, which aren't party political. People will have their own held views on that. That's the same as it's been in the past. So I respect that some people would disagree with me on this. But again, I think this is the right long-term thing for our country. Smoking causes 1 in 4 cancer deaths. It's responsible for a hospital admission every minute. And if we don't do something about it, hundreds of thousands of people will die in the coming years. And I think we do have a chance to do something about it. And if we raise the smoking age incrementally, that will mean that people stop smoking, and the vast majority of people take up smoking when they're young. If we can stop that start, then we'll be well on the way to making sure we have the first smoke-free generation in our country. We know that this works. When we raised the smoking age to 18, we saw a big fall in the number of young people smoking. When the US raised their smoking age to 21, they also saw an almost 40% reduction. So if we can get this right, we'll be able to do something incredible for our country, also wonderful for the NHS to relieve the pressure on it long term and save billions and billions of pounds that smoking costs our society.